Good day and welcome to Conversations with AARP in the Virgin Islands. I'm Troy Deshabert-Schuster, State Director of AARP in this territory, and thank you for joining us today. I want to welcome you to this important discussion about the coronavirus, properly known as COVID-19, here in the U.S. Virgin Islands. AARP, a nonprofit, nonpartisan member organization, has been working to promote the health and well-being of Americans 50 years of age and older for more than 60 years. In the face of the global coronavirus pandemic, AARP is providing information and resources to help Americans and those caring for them. The Omicron variant is spreading rapidly across the nation, leaving businesses and governments struggling to respond. AARP urges all eligible Americans to get the vaccine and to get the booster uh, so that we can help to combat this virus and put an end to the pandemic once and for all. Almost 2 years later, COVID is still with us and will be for some time. Here in the territory, we now have more than 3,000 Virgin Islanders infected by the latest variant. None of us knows what lies ahead with the virus. All we can do is keep taking the precautions recommended by healthcare professionals to protect our health and that of our family. Today, we will hear from Justa E. Encarnacion, Commissioner of the Department of Health, and Dr. Hunte-Caesar, Medical Director of the same department, about how we can combat COVID together, as well as learn the latest about the Omicron variant, vaccine distribution, and new updates on how the territory is addressing the pandemic. And so we welcome Commissioner Encarnacion and Dr. Hunte-Caesar. Good day, ladies.
Good day to you.
Good day.
Thank you.
Thank you
And
for having
so
us.
thank you for being with us. And as we were discussing before the program, AARP thanks both of you and your teams for all that you're doing through this pandemic. You have always been very responsive to the call of AARP and the guidelines of the CDC in providing the vaccine to the older population first and making sure that they receive the boosters. And we know that both of you and your teams are continuing to work really hard on protecting all of us. So thank you for all that you do, not only for the older people in the Virgin Islands, but all Virgin Islanders and all visitors to this territory.
It's our pleasure. And I think that one of the things you spoke about is the older population, 65 and older, 60 and over, but in particular 65 and older, being the first to receive the vaccine. And I have to tell you that our percentage of vaccinated individuals in that age group is actually 84.3%, which is above all other age groups. So it's working with you and working with the team has proven to be very effective for us.
Yeah, thank you. Now, I understand that here in the Virgin Islands, at least up until the beginning of the Omicron variant, that we had one of the lowest vaccination rates in the United States. Is that so? And where are we today in general among the general population here in the Virgin Islands?
We're still pretty low comparatively to all the other jurisdictions. Puerto Rico is really one of the highest. We are still within one of the lowest group. But like I said, the population of 65 and older being the highest has supported where we're going with Omicron, as well as all the other variants that we've seen. Dr. Hunt works very closely with DHHS. We meet with them on an ongoing basis so that we can get their support as well.
Yes, and Dr. Hunt, can you tell us a little bit more about how dangerous is this Omicron variant? At least we're hearing on the news that it's not as dangerous as others, but from your perspective, please share with us.
Sure, and thank you so much for having us. It's such an important conversation to address the senior population, but also just the general population in the territory as it relates to the Omicron variant. So we are seeing that the Omicron variant might be presenting with milder disease. Unfortunately, that's not the case for individuals who are unvaccinated. So what people really need to understand is that the coronavirus, regardless of what mutation or strain you are affected with, you can be affected with very severe illness and disease and potentially die from the infection. So we are seeing that the Omicron variant is producing milder disease, but in those who are vaccinated. And as you know, that the vaccines were developed to prevent moderate to severe infection and death. So we knew that people could still be infected even if you're vaccinated, but the point was to just limit to no symptoms or just mild symptoms. And that's exactly what we're seeing with the Omicron variant. And unfortunately, we're seeing severe disease and even fatalities from those who are unvaccinated, even if they're infected with the Omicron variant.
Now, I was under the impression that when a bacteria or a virus mutated, it would mutate to get stronger so that it can survive. How common is it for us to see a virus like COVID-19 mutate and get weaker, seemingly, but yet more contagious, but weaker in the sense that it's not causing as much severe illness?
Well, I think that you hit it on the head when you said that, viruses will mutate to be stronger or just to survive. And that's exactly what the variant has done. This variant, even though it causes milder infections in those who are vaccinated, is continuing to be extremely relevant and contagious in the population who are not vaccinated. So that's exactly what it's doing. And you have to understand that that while different variants might not actually turn out and pan out to be very strong within the population, then you have other variants that arise. So at any given moment, you're going to have at least 5 or 6 or even unmeasurable or uncountable amount of variants that are circulating within the population at any given time. It's just that there are certain variants that actually dominate and are more contagious, and then will exist in the community at higher rates as opposed to other variants. So you're correct. It's just that some variants might not dominate, and there will be dominating variants that will continue to beat out the other variants.
Okay. Now, according to observations, the Omicron variant is now the dominant one. How is this administration, Governor Albert Bryant's administration, responding to the Omicron surge and the coronavirus pandemic? And what is the long-term strategy for managing this virus? And I think maybe Commissioner Encarnacion would be more suited to answer this question.
Yeah. So I think one of the things that we've done is we've continued communication amongst our group. And that is, of course, it starts from the administration. We meet with the governor twice a week. Meet with the hospitals who are severely impacted by all of the variants that we have seen, the ups and down in reference to not just Omicron, but Delta and all the other variants that have been here before. So we meet with them on an ongoing basis. We facilitate a meeting. Dr. Hunt is on. I just recently invited her to be on the meeting with the governor, being the medical director. We want to make sure we have the medical eye and ear as well. So that's critically important. The both CEOs for the hospitals are on the call, as well as some of our other cabinet members and the governor's supporting team. That's key. Communication is key, and flexibility is also key. The governor is one, he listens. He is able to manipulate, to maneuver information, to take the information. He challenges us. The good thing is that he allows us to challenge him. And that's the only way that we could be as successful as we have been, by being able to have those frank discussions going back and forth, coming out with the best conversation. I'll give you an example. One of the questions that he asked us this morning, what should we be doing differently? It was first posed to the hospitals. What is the hospital seeing? Because if you listen to Fauci, if you listen to the president, if you listen to Dr. Walensky from CDC, they're telling us, let's focus on hospitalizations. We know Omicron is not as severe, so if your hospitalizations are down, you should be doing okay. So we go to the hospitals. What are your thoughts are? I go to Dr. Hunt because she's not only the medical director of the Department of Health, but she is the only infectious disease physician we have within the territory. That is a plus, a benefit to us. She sees the patients. She sees the events for the COVID-19. So I go to her, and what are we seeing right now? We've seen an increase of acuity levels within our community. So it's a caution that we now give back to the community. One of the other things that we've always done is testing. The quicker you could test, the quicker you can isolate the virus, the disease, and you can actually isolate or quarantine those that need to be quarantined. You teach. We do that on a weekly basis on our press conferences. We Facebook. We have our website is updated continuously. We have you cannot turn the radio on and do not hear something from the Department of Health. And our radio supporters, which is to me astonishing, they do an incredible job repeating the information that we share with them on an ongoing basis. I have to tell you that we also try to change our message because sometimes you go deaf to something and you hear all the time, right? So we try to change it around. We try to add children to the communication. You see, MCH now has a lot of information being shared out there. Schools are now opening. I did a press box with the commissioner as well as assistant commissioner of education, Raquel Berry Benjamin and Victor Sum III, about 2 weeks ago, informing the public about what we're doing with schools. This week, our focus this week is we still want to get children back in school, but how do we get children back in school safely? So Dr. Esther Ellis and the CDD team, our communicable disease team, Jason Henry, they're now working with our private schools. They begin first. We would be able to let you know, are we finding positives in our private school before we even open the doors to private schools? That gives us somewhat of a vision of what we can project for our public schools. We're also now testing our public schools, our frontline workers, our dietary workers, our housekeepers that are starting as soon as possible because of course, the No Child Left Behind, everyone has to eat. So we need to get the food out there. So we're flexible. We do what we need to do. We educate, we train, and we answer phone calls.
Yes, and the communication from the department, from your department, and the communication from the governor both are really exceptional. And I'm glad to know that the radio stations are so very supportive. But yeah, it's true. Wherever you turn, on Facebook or turn on the radio, anywhere you go, the signage that's in all the stores about wearing masks, the communication really is outstanding. And now, Dr. Hunt, what do you see as the prognosis, if I may use that term, of this pandemic, the long term? Is it something that's just here to stay and we just have to learn how to deal with it forever and ever? Or do you think that it will eventually die down and go away? What's the outlook?
Well, I think it's important to understand that the coronavirus is different to other viruses, such as the flu virus, in which we've had a lot of experience in history. But that's the only thing that we can look at to try to estimate or guess as to what might happen in the future. When you look to the past pandemics, you can see that, and I mean like respiratory illnesses, sometimes it takes on average of about 3 to 5 years for the actual virus to stop being a significant burden to the community, and the deaths actually really come down significantly. Now that is back in history when we did not have access to vaccines. So that is the only difference that we are dealing with now. When we look at major pandemics in the past that have significantly taken out a large population because of the comorbid or because of the mortality, because of people dying from the illness. So if you were to ask me, it's really hard to say exactly what will happen, because the coronavirus is not like the flu virus. It does not change and mutate to different viruses like the flu. but we have something very similar in which you have different variations of the same virus can arise just so that it can stay within the society. What is also different now, as opposed to centuries ago and throughout history when we had other pandemics, is that we have a lot of global travel. And we have people who can be in China in one day, and then they can be in Australia in the same day, and then they can be in South Africa in 2 days. So you have a lot of travel that is happening just because of leisure, but also because of business, and because of the economy and the way that the world works today. So because we have such high travel and the potential for fast disease spread, unless we actually have the entire globe, everybody in the entire world immunized and vaccinated at one time, that is the only way that we're going to make a significant impact. And we can talk about what we can do within the territory to keep our community safe. But the truth is that unless we immunize and vaccinate the entire world and get vaccines to countries and people who are not able to get vaccinated, and you have continuous travel the way that it happens, then we're going to be seeing this disease impact us for at least another few years. And I feel that's exactly what it's going to take. It's going to take at least 5 years for the disease burden to come down significantly, where it can be something that we can potentially talk about, like how the flu affects individuals or populations outside of pandemic flu seasons.
Yes. Now, I'm sure that I'm not the only person in the Virgin Islands experiencing pandemic fatigue. We're all just tired of it. I've always viewed myself as being one of the most happy and optimistic people. And yet sometimes I even feel a little bit depressed by this pandemic. And I feel like down when I'm here working at home all the time. I can't be in my office. I can't go out and have participate in big celebrations because big celebrations are prohibited, etc. And so, as more and more people in the community are probably experiencing the same thing, Commissioner Encarnacion, do you find that people are still being compliant with the rules of the administration, or are people starting to fight against that and just doing what they want to do? How are the people responding to all of the guidelines?
I wouldn't say fight against it. I would use the word that you use, and that would be fatigue.
Mhm.
And so, because they're tired of the consistency of remembering every single thing that we're asking them to do, you see that separation from reality. And if you deny that it's actually happening, then it's easier for you to not follow the rules and regulations that that confront you. But I have to say that one of the other things that we focus on is behavioral health and being mindful, and emotional health and emotional wealth really is what we need to look at. And so we haven't forgotten that part of it. We always say that COVID-19 is not just a physiological disease, but it's also an emotional and a mental health disease, because those that are affected can go into crisis at this point in time. You spoke about feeling isolated. There's some individuals who go through depression on an annual basis, and sometimes on a consistent basis. And so you have to bear that in mind. So telehealth is something. Look at what we're doing right now. We're able to communicate even though we're all supposed to be separated from each other. We're still able to communicate, and our behavioral health entity, linked with private partners in the community, increase our level of work through telehealth services. And Dr. Hunt also provides some of her work in through telehealth as well. So some of those are some of the things that we do. One of the things, I'm going back to businesses now. We spoke about that this morning, and we have a mitigation meeting in Department of Health that really includes not just Dr. Hunt and the medical, but also environmental health and some of the other staff members. Let's look at it from an objective. What should we be doing? What should we be teaching? What should we go back to? And I always say, let's go back to the beginning. COVID itself hasn't changed much. The variants have changed, increase in acuity level, decrease in acuity level, increase of transmission. You're going to see that variation come about. But if we look at it from what we need to do, that piece hasn't changed. You know that you need to physically distance. You know you need to wash your hand frequently with soap and water. You know you need to use hand sanitizer if you don't have access to soap and water. You know that you need to wear your mask above your nose and below
Mm.
your mouth, right? Okay. And finally, you know that you should be vaccinated. Some of you may have a hard time understanding what that really means or how it would impact you, or the or want or let's say you have decided not to become vaccinated. There's some things that if you truly are not going to be vaccinated, follow the other guidance that we're asking you to follow, noting what Dr. Hunt said. In order for this to actually dissipate everyone, not just here within a territory, we're going to protect ourselves, but travel continues. So everyone within the world, look at what happened in South Africa. That's where Omicron began, right? And for that same reason, they were not vaccinated to the degree in which they could have been vaccinated. We at least have a level of vaccination that we can say it's right now over 50%, 60%. We want to see it go to 70%, 80%. It's, in terms of herd immunity, it's hard to say what herd immunity is going to bring about, what level. We can't really say. We used to say 70%, but now we need to get it as high as possible. And the way to do that is through vaccinations. So we just push that.
Absolutely, absolutely. And talking about vaccinations now, the boosters have been available for some time, and I was just counting up my months prior to this show, and the end of February will be 6 months since my booster. So, Dr. Hunt, tell us about the boosters and how often should we be getting a booster shot? Should we get it every 6 months, every 8 months? And what's the guidance there on that?
Sure, it's very important to understand that the guidance is not something that is recurrent at this point. So, because we are still new, this is still a new infection, we are still getting the data from the individuals who have been vaccinated and who have participated initially in the trials, and additional trials are continuously ongoing. So, while we don't know how the virus will continue to change, there is not a recommendation yet to say that you should get a shot every X amount of months. But what we do know right now is that the messenger RNA vaccines or the Pfizer or Moderna vaccines have better coverage than the Johnson & Johnson single dose vaccine. So what we are recommending is that people get boosted at 2 months after receiving a single dose Johnson & Johnson vaccine, or 6 months after receiving a Moderna vaccine, or 5 months after receiving your second dose, I should say, of your Moderna vaccine. So 2 months after a single dose of your Johnson & Johnson, 5 months after your second dose of your Moderna, and 6 months after your second dose of Pfizer. You should be boosted with the preference of Pfizer or Moderna and not Johnson & Johnson. People have their choice to get whatever booster they want, but those are the official guidance and recommendation that the science and the data has shown to be most protective from the Centers of Disease Control and Prevention.
Okay, so again, just to be clear, there's no guidance yet as to whether somebody like myself who was boosted 6 months ago, well, 5 months ago now, if I should get boosted again.
Correct. There is no information for recurrent boosters. I'm sure that data and the recommendation will be forthcoming once we have additional information on the development of other variants, as well as vaccine response from booster doses. So it's not to say that we know exactly what the immune level will be every single time we get boosted, because that might actually be different. Your immune response might actually be higher after a booster than it was with just a second dose. So it might actually mean that after a booster, you might actually be protected a lot longer. We don't know yet. We don't know yet if this is necessary. Because remember, the booster was actually recommended to be given for protection against the variants that were arising. So we're keeping our fingers crossed, and hopefully we don't have any more variants. But we have to plan and prepare for that possibility, because what we have gotten comfort in right now is knowing that the variants that have come out are what we call variants of concern. And that means that our medical countermeasures, including our vaccines, still have protection against those variants. But we are bracing ourselves and preparing for the possibility, and hopefully not, the development of variants of significant impact or significant concern, which would mean that we would have to revisit the current vaccines that we're giving and the current medical countermeasures like the antivirals that were recently authorized for use.
Great. And to go a little bit further with the boosters, you could tell I really want another one, right? Which I actually do. If I opted to get a second booster after 6 months, can I do that, or is that prohibited?
Well, we actually follow the federal guidelines, and we are not authorized to provide vaccines that are given to us by the federal distribution outside of the authorizations. So at this point, we would not be allowed to give you any additional doses outside of what we were allocated for. And it's very important that we follow the federal guidelines. These are agreements that we are in with the CDC, and we want to follow the rules, and we want to make sure that we steward our resources as best as possible. So we would not be authorized to give it unless we get the guidance from the jurisdictional meetings that are guided by the federal guidelines.
Great. Okay, thank you. And Commissioner Encarnacion, we're almost out of time, but if you will tell the people listening in our audience as to where they can find the best and most up-to-date information on the pandemic here in the Virgin Islands.
Of course, but before I do that, I want to say that I wish that most people were as enthusiastic as you to get vaccinated. So it was one of the things we're asking to please visit our CBCs. We are one of the few jurisdictions that have maintained our communication vaccine centers, making it easier for the general public to know where they can go to get vaccinated. So in St. Croix, it's at the Nissan building. In St. Thomas, it's at our community health center, which is on the second floor of the Royal Leicester Snyder Hospital. One of the things that, and I will let you know, we're doing a lot of testing right now, as much testing as we have accessibility to our vaccines. So our pop-up testing, we do two things. We do our drive-through testing. And the drive-through testing, we ask that you go online and you basically request your own appointment. You can actually select what time you want to go through the drive-through, which makes it easier for our workers to be able to process you. The information is shared on that website. When you get there, it's easy. You're tested and you go through. It's usually a 15-minute test. However, we also run a 24-hour to 72-hour test, usually 24 hours when you get the results, and that's sent to you electronically. And that is on St. Croix at Charles Howard Complex, St. Thomas at Shadow Region Medical Center, and that is from 9:30 in the morning until 12 p.m. And of course, in St. John is at the pop-up. It's at the pop-up testing in St. John at the Gravel Yard at Port Authority, and that is on Tuesday, Wednesday, and Friday, and that is from 12 o'clock to 3 p.m. And then, of course, we have our pop-up testing, which is a little different. The pop-up testing is where we ask that you go online, the same website that we spoke about, www.covid19.usvi.care/testing. And I'll repeat that, www.covid19.usvi.care/testing. That's the same website you go on for the drive-through and the pop-up. The difference is with the pop-up, you do not necessarily have to register. You can show up, and that is from Monday to Friday at Charles Howard Building, and that is from 1:30 p.m. to 3:30 p.m. St. Thomas at the SRMC drive-through location, and that is 1:30 p.m. to 3:30 p.m. And St. John is the same area we spoke about. That is at the VIPA gravel lot, and that is Tuesday, Wednesday, and Friday from 12 p.m. to 3 p.m. And of course, you can always go to our website on DOH, USVI, DOH at USVI.com and get more information. You could go onto our Facebook page as well and get information there. Important information to share. We are not doing as much contact tracing as we've done in the past. And the reason is we focused our attention more on the testing because we can test, we can isolate. We are contact tracing those that have been hospitalized and discharged, those that are immunocompromised, those that are high risk. That's important that we keep track of them. So you may not be getting a call every time you see that you have a positive result. However, if you need documentation to return to work, we ask that you email us at results@doh.vi.gov. And that is results@doh.vi.gov. And of course, listen out to our briefing with the governor every Monday at 1 o'clock. And that's also shared on Facebook. And so there's so many different places that you can get the information. We are always on radio. And let me just thank you before we close out. I really appreciate the opportunity for you to have us here, for me to be able to invite Dr. Hunt with me, and welcome being back on your show, welcoming conversation, and really appreciated it. So thank you so much.
Thank you so much, Commissioner. And we are out of time, but I thank you and Dr. Hunt for being with us today and sharing this important information. And we look forward to having you on future shows with us.
Thank
It was
you.
Have a great
our
day.
pleasure. Thank you.
Thank you. Great day.